Welcome to the eClinicalWorks podcast. We've been speaking a lot with community health centers about some workflows and improvements that they've made in their practice, but all of this can be for nothing if we can't get in touch with the patients. And here to talk about that with me today is Lynn Blankenship.
Hi.
Lynn, welcome to the show.
Thank you. Thanks for having us. We're excited.
So you're making use of the campaigns through healow Messenger, which
Yes.
is going to get in touch with your patients automatically. Tell me a little bit more about that yearly visit campaign.
Okay, so last year, in the fall, we decided kind of phase one of our project was to roll out the yearly visit reminder. We chose that campaign because it really had the broadest outreach to the majority of our patients. It wasn't a medication-driven, it wasn't a disease-driven, it was a yearly visit reminder. And number one, everybody needs a yearly visit. That's just good medical practice. And number two, it's a PCH requirement to reach out to patients for a yearly visit, and also a managed care requirement. So this campaign will go through and it looks for patients who haven't been seen in a year and also do not have an appointment scheduled in the future.
And it'll just reach out to them automatically.
Right,
Through
based on that logic, right.
Phone, call, text message, email,
App,
whatever.
email. Currently, we have chosen to use voice only. That is our method of delivery. But as time goes forward and we add more campaigns and get more comfortable, and the patients get more comfortable and educated about all of the modes that we can reach them, then we'll start rolling out other methods.
What kind of an impact has that yearly campaign had for you guys?
It's been impressive. Of course, when we approached executive management about it, of course, it's money. You know, how can we justify this? And so we rolled it out at the National Users Conference, or at the Users Conference for FQHCs in April. If you remember, we presented with Merlin. We were very, very conservative, and we only looked at medical visits. We stripped out dental, we stripped out optometry, we stripped out OB. So eCW gathered information from our system on these calls, of the calls that went out, the patients who scheduled appointments, and the completed appointments. Again, very conservative. We had 799 unique patients complete 1,135 encounters. Again, just medical. And using our payer mix, because we balanced it against, the payers. And of course, once you get a patient back into your system, we had added optometry since some of those patients have been in. So now they're going to utilize, and we found once we started validating the data, they were seen in optometry, they had dental visits, they utilized our lab and x-ray, and of course we have pharmacy on site too. So just getting the patient in creates that whole patient experience. And then just recently, we now looked at another quarter. We went from March to May. Now the numbers have dropped, but that is to be expected. You know, when you first start a campaign, of course, it's a dump of patient information. It's a lot of patients. So now that everything is caught up and it's going out systematically, from March to May, we had 231 unique patients, complete 333 encounters. Now executive, it's easier to go back. Now they've seen the benefit. So it's very economical. Obviously, it's effective. And now when we approach them with other campaigns, they're very much on board.
And of course, with the yearly visit reminder, that's really what you want. You want that number to shrink, right? Because that means that the patient is then getting those yearly visits and getting those services that they need.
Exactly.
So what are some of the other campaigns that you've been eyeing?
Well, that's a good question. So of course now you've talked to Shamira about our PCMH and that road. We rolled out this month the hemoglobin A1C and the colorectal cancer screening. So that's been going out in July. Of course, with diabetics, you always, it's all about control. So getting them in for their hemoglobin A1Cs. And then also with the colorectal cancer screening, we signed an American Cancer Society initiative to have all of our patients, 80% of our patients screened by 2018. So that's going to help us meet that. In addition, with that road to PCMH, we were very excited to find out that eClinicalWorks has just been certified for auto credits on many measures, and one of those measures is on using your data for population health. So we're going to be adding cervical cancer screening and the pneumococcal. So it's going to help us meet that 3D 1 through 4, I think is that measurement, if I'm correct. And then, of course, flu season right around the corner. So we're going to be activating the flu season campaign. So very
Lynn,
excited.
You've just stolen everything that I was about to say on camera here. Yes, you're absolutely right. We have received some additional pre-validation credit. We can now give up to 44 factors for pre-validation, and of course, like you said, you got it just right. 3D 1 through 3 and 4 good. Are all eligible for auto credit if you're using the healow messenger campaigns like they are here.
Exactly.
So congrats on that.
Thanks.
You're very knowledgeable about that.
You know, one of the other things I wanted to mention too, with our partners in the community and with our managed care companies, when we explain our patient engagement program, they are very impressed that we're using the platform and using the system the way we are and using campaigns.
Have you had any challenges associated with your particular patient population? I know a lot of the pushback that we get from some practices is that, you know, this patient engagement stuff sounds great, but my patients are different. They won't get it or it won't work for them. Now, you work with underserved or uninsured patients.
Right.
So can you talk about that a little bit?
What we always say is you never underestimate your patients. You know, we believe that our patients will use the technology just like any other patient. Yes, there are some challenges, but we, of course, we send out in different languages. We try very hard at our locations, at our sites, to educate the patients on, this is a way to communicate with you. And when you get our phone calls, it's all about health reminders and keeping you healthy and helping you get to where you need to be with your disease control, or just to keep you healthy and do the things that you need to be doing. So I think a lot is, again, you can't underestimate your patients, and if you reach any of them, it's better than reaching none, rather than going, oh no, we're not going to use that technology because that's not going to help us. If you reach 8 to 10 to 15, it's better than none.
So you've made a difference there in that, even in that small patient
Again,
population.
I think it starts at the site, and it starts with the provider too, going, this is how, this is a tool, we have many tools in our toolbox, but this is a tool to help me help you. So you have to help me help you.
Campaigns, right? Why use a campaign instead of going into the registry and finding a group of patients and sending out messages through Helo Messenger or through the patient portal? Why do the campaigns?
Exactly. Well, I joke and sometimes I tell people that campaigns are kind of like the Ron Popeil, it's like set it and forget it. But actually it allows you to work smarter and not harder. Campaigns run, you're putting this information into your electronic health system. Let it work for you. I remember, I'm going to date myself, but you had patients fill out a postcard and you wrote when they should come back down, come back in, and you stuck it in a little file, and so then you had to pull them out a month before they came. You had to stick the stamp on it and mail it out. A very manual process, and really no way to measure if that was effective. Was it working? Did it get your patients back in? Who knows?
Because who's going to write you a letter back and say, I'm coming?
Oh, I'm coming in, or call. So again, you have to leverage it. I think the most exciting thing about the electronic health record to me is using that to get the information back out to, how would you have ever known in all of those charts that you had patients who hadn't had hemoglobin A1Cs, or that you had patients who were falling through the gap? You would never ever know. So I think that is the biggest thing, is that it allows you to work smarter, not harder. Let it take the logic and run through your system and pick out the patients who fit the criteria. Is it that they haven't been seen in a year? Is it that they haven't had a colorectal cancer screening? Is it the lipid panel with the, is it hypertension control? Let the system that's its job, is to be smart and work for you.
There are so many campaigns available.
32.
Well, you've counted. Okay, so I didn't even count them. But one of the big ones I think that a lot of people ask for is the no-show campaigns. Have you started that one yet?
No, we haven't. We've looked at it. Right now, of course, the yearly visit reminder, very important. The preventive health screenings, very important. There's a happy birthday reminder that would be neat too, to get a call from your provider going, hey, happy birthday. But right now, that one's not off the table. The health screenings were priority, and then phase 2, maybe later in the year, we'll start looking at the no-show.
Well, it's good to know that we don't have to jump right into all of
Right.
them. We can take a phased approach to it, step by step.
Exactly.
Take them as we find successes
Right.
with them, and make sure that they're running properly.
Right, and that's the neat thing about the campaigns too, because you can control the volume of calls that go out, so you don't overwhelm your call center or the staff that's going to take them. So you can set it that so many calls go out per day. You can edit them, and that's wonderful too. So you can add a verbiage, or customize it a little bit more. So that's a neat feature also.
Yeah, you don't have to take what's given to you out of the box. You
Exactly.
can customize it
Right.
to your needs.
Exactly.
How long have you been using that hemoglobin A1C?
We started that this month.
Oh,
so,
just
yes,
this month?
just
Okay.
this month. So not enough time to get real, true, measurable data out, but very excited about that one. So
Well, we'd be looking forward to find out how that turns
Yes.
out eventually.
yes, and the custom campaigns too. That's another a neat feature that wasn't there when the campaigns first came out. So we're very excited about that one, because now what you can do is you don't have to rely on the system. You can create your own campaign, and one of the
What
ways
sorts of thoughts have you had on those?
the custom?
Yes.
Oh, I think it's amazing, because now what we're going to use it for is that tedious. You get the managed care list that the newly assigned patients to you for the month. So what did you do? You either sent it through Word and made the data merge, but and then put it on a postcard and mailed it out. Now we're going to upload that file and call those patients and introduce them to the practice. So we think that's a great way to utilize a custom campaign.
It sounds like that'll be very effective. Another new campaign that's out there is the multiple chronic conditions
Right.
campaign for chronic care management. You can check those out in the campaigns page of Helo Messenger. And Lynn, best of luck with all of these
thank you.
initiatives. It sounds like you've got a lot of things good going on.
We do, and I will tell you that the campaign team, the messenger team, is a wonderful team to work with. They have been so helpful. They walk you through every step. They answer any question. They checked up on us as the first few days of the campaign, and even reach out now. So that is the other thing, that eClinicalWorks makes it so easy for us to adopt these new technologies, and always a step ahead of where we think we need to be. So that's important as a software too, that we're very proud to use the software.
Oh, and of course, don't forget the Helo campaign dashboards.
Oh,
of course, to show you how well the campaign's been running.
Yes, very important.
Well, Lynn, thank you so much for your insights today. It's been a pleasure having
Well,
you.
thank you. We're happy you came to visit us.
Check out more of our podcasts on YouTube, iTunes, and my.eclinicalworks.com. For the eClinicalWorks podcast, I'm Adam Siladi. Thanks for watching.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.